Hi, Dr. Chuck Berg, River Vale Chiropractic Center. Wanted to spend a couple of minutes with you, my friends, my family members, and my patients, giving you a little bit of an understanding about the nature of what happens to our spine over the course of a lifetime. You know, as a doctor of chiropractic and as a holistic health counselor, we're always trying to encourage people to think long term, especially about your body and about your health. We live in an acute care healthcare system. An acute care system means if I have pain, I have a problem. If I don't have pain, I'm fine. And of course, we've learned that that's not necessarily so. But as it relates to the human spine, I have a plastic model that shows what happens over time to our body, specifically our bone and our discs. And if I can just focus your attention here on the set of bones closest to me, we see healthy bone with very healthy discs. We go out 10, 20 years later, all of a sudden you notice how the disc is a little bit thinner. It's beginning to wear out. We go out another 20 years and we start to see, I want to bring your attention to the bone itself, and notice how it has an erratic border. It just doesn't have that smooth border that's taking place before. And then if we go out, maybe 40, 50 years later, we see typical spines that show inordinate amounts of wear and tear arthritis. Now, some of you may say, well, that's what happens when you get old. Well, what I've learned is that our chronological age does not always equal our physiologic age. Now, what am I saying? What I'm saying is people who go out of their way to really take good care of themselves. In chiropractic, we advocate that people don't play just a pain game. We emphasize maintenance care of the spine. Coming in for periodic attention. Why? Because your spine has been used and abused through a lifetime. By most of us, by the nature of our work, most people today are doing what I'm doing. We spend a day in sedentary behavior. Well, guess what? If we don't move, we wind up drying up and tightening up. And for many of us, we wind up looking like a rusted gate. On the other hand, if we have that conscious willingness to put the time and the effort to constantly stay in motion, to stay mindful of keeping this body in all of its joints through active ranges of motion, there's a good chance that we can arrive down the road at 80 years of age, but have a spine that's looking 25 or 30 years. So in my 33-year career, I have been so surprised when I take an x-ray and I know that the patient is 78 years of age, and yet when I look at the x-ray, it almost looks like the spine of a 20-year-old. And then sometimes we wind up with patients who are 25 years old and they may have played football or lacrosse or just had a bad car accident, and as a result, their spine looks 30, 40, 50 years older than their actual chronologic age. So ladies and gentlemen, yes, it's impossible. We can't hang on to our youth completely. But I hope that this little presentation and this few minutes of video will help you to, more importantly, appreciate the impact and the importance of staying aware and really trying to pay attention to the human spine. After all, the spine is our lifeline. Taking good care of it is one very important step in terms of trying to grow older gracefully. Thank you.